this is a Facebook. This is the ID number.
I can't pull it up.
I sent it to your messenger, the link.
No.
Okay? Yeah. Dr. Sulaiman, welcome. I promote you to panelist. Can you hear us as a test? Dr. Sulaiman is into. Dr. Zeb Siddiqui, so far we have Dr. Sulaiman also. I promote him to panelist.
Yeah, yes, sir. I have joined.
Oh, is this Dr. Sulaiman?
Yeah, yes, sir. Right.
Okay. Assalamu alaikum.
Walaikum assalam, sir.
Good. So you're one of the panelists as well. So when the time comes up, as I send the instruction, I'm going to invite you to start your presentation.
Yeah, okay, thank you, sir.
Good morning, good evening, and good afternoon, where you are. Thank you so much for attending to this unique conference. Greeting and peace to all of you. So as you know, this first Bionatural Healing Conference virtual, I welcome you all to this special program. And it's my honor. My name is Habib Mohammadi. I'll be your host for the day. So I'm proud, and also I'm honored to have you guys in this special event, which after a lot of hard work put together for you. And thank you all, the participant that you showed up in this early morning in California time, and wherever you are, I welcome you all. Thank you so much for coming. As you know, we're going to have a few hours, and today and also 7 p.m. of the other session, and tomorrow as well, we follow the same schedule. Before further ado, I would like to ask Dr. Siddiqui to come forward and start the introduction. Dr. Nader Siddiqui, Conference Chair, Founder, President, Dean of Academic of Bio-Natural Healing College, BNHC. I would like to present Dr. Siddiqui. Dr. Siddiqui, welcome.
Thank you, Mohammed Isef.
Move on, you can start your presentation.
Mohammed Isef, thank you.
You're
welcome. On behalf of Bio-Natural Healing College, the entire team, the committee, the conference committee, and myself, I would like to begin. I would like to begin with greetings and peace from Sunnyside, California, to everyone, respected colleagues around the world who are attending this virtual event and watching us. I really appreciate, on behalf of BNHC and myself, and thank you for your all participation, especially Honorable Professor Barbary and other colleagues, despite difficulties from my beloved native country, Afghanistan, in this first Bio-Natural Healing Conference on May 24th, 25th, 2021. As we know, humanity suffered severe pain and loss of their loved ones in the past 17 months due to COVID-19. However, on the other hand, this pandemic is a great lesson and experience to admit the fact that we all, as a human society, need each other, no matter where we are belong on this beautiful planet of Earth. We are blessed with technology and diverse presenter, the valuable presentation of this virtual conference. According to Islam, the creator of creation, Almighty God says in Quran, verse 13 of chapter 49 of them, O mankind, indeed, we have created you from male and female and made you peoples and tribes that you may know one another. Indeed, the noblest of you in the sight of God is the most righteous of you. Indeed, God is knowing and accounting. God is knowing and acquainted. Before I begin on the conference theme, Bio-Natural Healing, which is a broad topic, it would be appropriate to bring our attention to the reality that all the system of ancient medicine, such as Egyptian medicine, Greek medicine, Chinese medicine, Ayurveda, Unani, acupuncture, Siddha, African traditional medicine, traditional European medicine, Tibetan medicine, prophetic medicine, and modern medicine, all in their approach is concerned to understand the relationship between patient and disease for the treatment and healing process. As you all know, that Hippocrates pointed out in the 4th century BC that how food could be our first medicine and how a balanced diet could help maintain health. Indeed, the 2020-2025 American Dietary Guideline stated that the diet-related chronic diseases such as cardiovascular disease, type 2 diabetes, obesity, some types of cancer are very prevalent among the Americans and pose a major public health problem. Therefore, this guideline encourages healthy consumption pattern at each stage of life and recognize that individuals will need to make shifts in their food and beverages choices in order to achieve optimum health. According to National Institute of Health, NIH, 2020-2030 strategic plan, precision nutrition means specific to dietary intake of individual. An important component of precision medicine deals with personalized treatment of diseases. On the other side of the spectrum, precision nutrition brings our attention to consider multiple synergistic level of influence. For example, dietary habits, genetic background, health status, microbiome, metabolism, food environment, physical activity, psychoeconomic, psychosocial characteristic, and environmental exposure. All these vital issues are important in the optimum health of individual, family, community, and humanity. Let me share of the principle in regard to health preservation, Ibn Sina, Avicenna, in the year of 9 AD 1037, who is considered one of the greatest medical scholars, the author of Canon of Medicine and the Book of Healing, with remarkable contribution to humanity in history. There are 8 principles. I will brief in one of his principles. The quality of nutrition should be according to is her temperament, and in general, she should some food in a balance, should eat some food in a balance with her temperament. Therefore, our theme of the conference encompasses healing and wellness in the broader concept. Because of diverse topic our respected speaker will talk about, includes physical wellness, spiritual wellness, emotional wellness, intellectual wellness, social wellness, environmental wellness, occupational wellness, cultural wellness, and financial wellness. Also, it is crucially important to admit the fact that the role of soil connects to human health. It is well known that you are what you eat. Interestingly, that synthesize the role nutritious food plays important role in human health. If we dig a little deeper into this topic, it will take us to the vital horizon of soil and plant-based food connection. Maintain and sustainable healthy soil is directly or indirectly related to human health. For example, impact of persistent organic pollutant and pesticide used in agriculture field are associated with an increased risk of developing several chronic diseases such as diabetes, cancer, asthma, neurological disorder, Parkinson's disease, Alzheimer's disease, skin, high irritation, and headache. As stated in the article, Soil in Human Health, Current Status and Future Need, 2020. Researchers describe the human body consists of about 10 times more bacterial cells than human cells. The majority of them are in the gut, along with other microbiomes such as fungi, virus, protists, and archaea that play a significantly important role in our metabolism, health, and well-being. Similar to human gut, the plant rhizosphere, the crucial part below ground roots, are by natural habitat for soil microbiome that provide plant with important nutrients, protect them from disease, pathogen, help plant to adapt to environmental changes. Interestingly, the human body can only synthesize 11 of the 20 essential amino acids themselves. they rely on food intake for the other 9 along with all 13 essential vitamins. For example, most of these amino acids and vitamins are received from meat, eggs, milk products, fruit, and vegetables, but few essential compounds are produced by microbes, which are important producer of essential amino acids and vitamins themselves. For instance, vitamin B12, cobalamin, cannot be produced by either plants or animals. It is synthesized by microbes in the plant microbiota in the gut of ruminant animals. It is crucially important to understand the maintaining a healthy human gut microbiome depend upon maintaining a healthy soil environment and plant microbiota. As we know that phytonutrient isolated from various medicinal plants and biochemical from beneficial microorganisms play an important role in the prevention and improvement of health and well-being of humanity worldwide in the past and continue to discover, utilize it for health benefit. Also, we know that plant chemical defenses can be recognized into 2 major groups: primary metabolites such as sugar, protein, amino acid, nucleic acid; secondary metabolites, phenolic, terpenite, and alkaloid. Secondary metabolites also involved with the plant defense against various insect and pathogens. Having said that, the human body is complex machinery and mixture of biochemical compound. Any disturbance or improper function of any organ of the body requires careful attention and essentiality to restore health. Indeed, bio-natural products and their derivatives play an important role in boosting the immune system and preventing diseases. Therefore, the demand for such novel bioactive compound is highly recommended due to rise in health issues such as type 2 diabetes, cancer, antibiotic resistance, infectious disease, and current COVID-19 pandemic, and other health-related issues. Our understanding of bio-natural product would admit the fact to recognize and appreciate the significant value of biodiversity conservation, a path to a healthy humanity. Quoted from one of my own book, Biodiversity Conservation, A Path to a Healthy Afghanistan. According to researchers, almost 25% of all of our prescription drugs owe their origin to natural resources. And the area of antibiotic and anti-cancer agent, the data is about 40%. Indeed, natural products play a crucially important role in all areas of human needs. Let me share some of the examples. Taxol from the Pacific yew tree for ovarian and breast cancer. Tabecidine from a marine tunicate for soft tissue cancer. Tetracycline from Streptomyces aeruginosa, artemisinin from Artemisia, doxorubicin from Streptomyces, and cyclosporine from Tolibaclidium inflatum. Similarly, cholesterol lowering, particularly with the levetiracetam from fermented fungus, Aspergillus, is the model for our modern cysteine drug, widely used in lowering risk of heart disease, is stated by author of the book, Botanical Miracle Chemistry of Plants That Change the World. However, current challenges that we have faced in the efficacy of bio-natural products, for example, lack of standardization procedure, lack of isolation of pure chemical product or compound, lack of lack of elucidation of biological mechanism and safety and regulation, documented clinical trial according to standard. As I mentioned earlier, that require a complete novel biology system approach, along with application technology, for instance, quantum computing, profiling techniques, computational biology techniques, big data, microfluidic, artificial intelligence, machine learning, genomic, transcriptomic, proteomic, metabolomic, metabolomic, and automation will enable scientists to use and find out more about therapeutic properties of plant-based as well as natural products for better understanding their particular effect in physiological condition and innovative drug design and bio-natural product. Last but not least, we hope with the vaccination effort around the world, thanks to all medical staff, and require the integrated bio-natural healing approach that will boost the immune system of humanity, plants, and animals toward back to normal life. We are optimistic the life will back to normal life. To think smart, prepare better for challenges such as climate change, vector-borne disease, food security, food waste, malnutrition, obesity, sustainable energy system, etc., and build a sustainable environment within our body system as well as on the beautiful planet of Earth. Without further ado, let me learn and enjoy from other respected colleagues. Thank you very much for your valuable time in listening.
Thank you, Dr. Siddiqui, for your profound remark. Now, at this part, first of all, for those of you who just join us, thank you so much for attending this special event and conference. Now, we have our next speaker is Honorable Professor Dr. Muhammad Osman Bawri, and the title is Natural Ingredients of Afghanistan and its Role in the Health Sector. Affiliation, Dr. Bawri is Vice Chancellor of Kabul University of Afghanistan and Professor of Pharmacology and Phytotherapy. And we are honored to have Dr. Bawri with us, and he's going to start this presentation. Dr. Bawri, thank you so much for attending. Floor is yours.
Thank you very much, Dr. Mohammadi. Distinguished friends, dear Dr. Siddiqui, President and Dean of Academic of Bio-Natural Healing College, distinguished friends from all over the world. Assalamu alaikum wa rahmatullahi wa barakatuhu. Good evening from Afghanistan and good morning, good day where you are. I am pleased to participate in this unique international virtual conference initiated by Bio-Natural Healing College. Well, as Mr. Mohammadi highlighted, I am going to talk about natural ingredients of Afghanistan and its role in the health sector. If you allow me, I would like to share some snapshot. Well, before to start the presentation, I would like to say that Afghanistan as a rich flora of medicinal plants, and therefore talking about the natural ingredients, it means talking about the medicinal and aromatic plants of Afghanistan. Therefore, probably I will use this term in terms of natural ingredients. The reason I ascribe is that Afghanistan traditional medicine and Afghanistan natural ingredients almost it's limited to the medicinal plants. However, we have some other natural ingredients with animal sources, and of course some mineral as well. Allow me to shortly talk about the Afghanistan geography. This country is a landlocked country and situated in the subtropical dry zone of Southwest Asia that have continental types of climate characterized by desert, steppe, and highland temperature and precipitation regimes. Afghanistan is a mostly rather arid country with extreme minimum of perhaps less than 50 millimeters of precipitation in the southwest and around 1.1 to 1.4 centimeter in the mountains of the central Hindu Kush to the northeast. Central Hindu Kush is a range of the mountains which bisect Afghanistan almost to two parts of the south and to the north and south. The main part of the land cover of Afghanistan, around 47%, is made up of rangeland. Irrigated agricultural land makes up 5.6%, and rain-fed agricultural lands make up almost the same percentage of the land cover. The 2.8% of the land cover of the country occupied by forest. The short climatic seasonality gives rise to the extensive development in Afghanistan of peculiar desert type of vegetation. As I mentioned it before, Afghanistan is mostly rather arid country. The wild vegetation of the most part of Afghanistan is rangeland, woodland, and forest. And this is strongly influenced by Afghanistan topography and geology. Agriculture has traditionally driven the Afghan economy, accounting for approximately 50% of gross domestic products or GDP before the Soviet invasion in 1979, and it made 28% in 2019. The flora and vegetation diversity of Afghanistan is rich due to its diverse habitats. The recent calculation and estimation showed that Afghanistan flora has more than 5,000 species, and better to say taxa, with 24% degree of the endemism. In this table, the number of families, genera, species, and taxa with the level of endemics has been illustrated. As you see, the number of taxa is more than 5,000. Afghanistan, the history of using plants for treating illness and traditional medicine among population of the country goes back many millenniums. Medicinal and aromatic plants in Afghanistan represent important health and economic component of the country biodiversity. While collection of these plants has a long history in the country and it contribute to traditional medicine and local economies of the population. Afghanistan is an important exporter of medicinal plants. Each year, this country export more than 50 different species to different countries. For instance, during 2016, Afghanistan exported more than 30 items with a total value more than 200 million US dollar. In the same time, I have to indicate that Afghanistan is predominantly known for producing different fruits as well. The main fruits grown in Afghanistan is grape, followed by apples, almonds, pomegranates, and apricots. In the east of the country, for instance, in Nangarhar, farmers grow subtropical trees, mainly orange trees. I have to highlight that the approximately 5,000 flowering plant species, more than 200 of them are known as medicinal plants. And as I mentioned it before, mainly these plants are exported, and the other domestic or internal use of these plants are limited to traditional medicine, folk medicine, and some few items are being used in pharmaceutical industry. It's very worthy to I have some snapshot here, but due to the limitation of the time, I'm not going to go through them. I included them because of the very crucial importance of them and the natural resources and geography and biodiversity of Afghanistan. It's very important to shortly said that the emerging phenomena of saffron and production and export of this product attracted organization and authorities working in economic sector of Afghanistan. While saffron production in Afghanistan dates back more than 100 years, cultivation remained marginal until a few decades ago. I would like to say some words about the challenge of the quality of production in Afghanistan. We are lacking, unfortunately, certification initiative and program. Therefore, I show here a histogram where shows the quality of production of 4 different production like licorice, bunium, cuminum, and ferula or hang, where you see in the right side indicated the number of different districts in this province, and as you see the status is not promising, is not acceptable. Here in this illustration, I am talking about the regression of the relationship by different factors on the quality of production, but again, due to the limitation of the time, I'm not going to talk in details. Well, we believe that the prospect of certification system for medicinal and aromatic plants, including saffron in Afghanistan, is very crucial. We are hoping to have some good achievement our academia at Kabul University, working with the Ministry of Economics, Ministry of Agriculture, to have good achievement in this regard. I studied the causal chain of the intervention for establishing certification system of MAPS as an example in Herat province. Well, please allow me to say, as highlighted before, that the traditional medicine has a very important place in the healthcare delivery system of Afghanistan, alongside to the tertiary healthcare, secondary healthcare, and primary healthcare. Afghanistan has a long history of use of medicinal plants, as I highlighted before, especially in Afghanistan, traditional medicine, Unani medicine, and as well as in folk medicine. Afghanistan traditional medicine is one of the complementary and alternative medicine that has played an important role to prevent and treat disease in various stages of life. This medicine is practiced by around 70% in rural areas of the country. Afghanistan traditional medicine is based on a set of systemic philosophical doctrines originating from Greek medicine and classical Greek philosophy. On the other hand, the close relationship between Afghanistan traditional medicine and ancient Greek medical philosophy is very noteworthy. I have to say that this traditional medicine includes a wide variety of therapeutic methods and medicinal preparation that can be attributed to the influence of Persian, Arab, and Indian Ayurvedic medicine. Study about medicinal plants used in traditional medicine of Afghanistan shows that 29% of medicinal plants are imported, mainly from India. Of the approximately of 5,000 species, as I noted before, more than 200 of these are known and as medicinal plants and used commonly in our traditional medicine. Information from Avicenna Pharmaceutical Institute, which is in charge of this sector and framework of the Ministry of Public Health, indicate that there are about 3,500 traditional Unani practitioners in Afghanistan. The process of registration has been initiated by the Ministry of Public Health during last decade. Studies in some provinces of the country show that the following types of traditional healers exist in various parts of the country. Unani physician or Tabibi Unani, who are not trained institutionally but has gained knowledge and skill through his family tradition. Secondly, limited number of Unani healers who practice traditional medicine of Afghanistan have been trained in the past by different institutions and Ministry of Public Health. A number of Unani physicians were trained in special training programs by the Avicenna Pharmaceutical Institute. Just I go through this very shortly, that the Afghanistan health status of met very good achievement during last 2 decades, but still looking to this snapshot, as you see that the life expectancy at the birth among the surrounding countries is very low, and there are many other problem. For instance, in this snapshot, as you see, deaths due to non-communicable disease in different age groups is high. So please allow me to conclude that the Afghanistan has very big and valuable opportunity for producing natural ingredients through medicinal and aromatic plants. We need to work on that, a lot of progress, but we believe that we have to work very hard in this regard. We have to rationalize the place and the safety of this ingredient in our regulatory, in our let's say, practice and clinics and traditional medicine of Afghanistan. There is a big opportunity to cooperate with other countries. Using this opportunity, I would like to welcome my colleagues, all colleagues who are attending this conference, to see how much we can contribute. The Faculty of Pharmacy at Kabul University is working very well in this aspect to study the flora, to identify them, to do the elucidation of these medicinal plants. We will be very happy to cooperate and practice through different joint study and research project. Thank you very much for your patience.
Thank you very much, Professor Baburi, for your beautiful presentation, very profound and beneficial. And thanks for your attendance. I wish you the best of luck. And you started on time, finished on time. I really appreciate it. You have a beautiful evening over there. Khuda Hafiz. Assalamu alaikum.
Thank you.
And now, my dear next speaker, our next speaker is going to be Dr. Falak Zeib, affiliation, Department of Human Nutrition and Dietetics, National University of Medical Sciences, Rawalpindi, Pakistan. And the title is Effect of Ajwa Date Powder on Body Composition, Lipid Profile, and Blood Pressure of Patients with Hyperlipidemia. I would like to ask Dr. Falak to join us. Welcome. Thank you so much.
Okay, the video is clear now.
Yeah, I see your screen and I see your video as well. You could start right now.
Okay.
Yeah.
Okay. Thank you so much for inviting me to present one of my research paper entitled Effect of Ajwa Date Powder on Body Composition, Lipid Profile, and Blood Pressure of Patients with Hyperlipidemia. This is actually one of the research of my master's student, which have been conducted in Peshawar, one of the tertiary hospital, Hayathabad Medical Complex. So I want to share some of the findings of the Ajwa Date powder. So actually, in introduction, we know that the onset of cardiovascular diseases and also the hyperlipidemia, which is one of the risk factor for cardiovascular diseases. Hello?
Yes.
Okay. Okay, the voice is clear.
We can hear you. Everything is fine.
Okay.
Yeah.
Okay. I thought there is some issue in the voice.
You're perfectly fine. Move on.
Okay. Yeah. As I told that hyperlipidemia is one of the main risk factor for cardiovascular diseases. So actually hyperlipidemia characterized by elevated high blood cholesterol level, and also if there is increase and take of junk food, fast food, etc. So there should be more chances of hyperlipidemia. Also, blood pressure and sedentary lifestyle in which physical activity is low than normal. So all these are the risk factor for hyperlipidemia. This picture shows the pathophysiology of hyperlipidemia. You can see that if there is normal cholesterol and also a normal triglyceride in our blood streams, blood vessels, so there should be a normal physiology of our blood vessel. But if there is elevated level of low density lipoprotein and triglyceride, also total cholesterol, and low high density lipoprotein, so there should be more chances of hyperlipidemia. So there are many complications of hyperlipidemia if we don't prevent or we don't manage our high level of our blood level. So it can lead to many other worse condition and many other chronic diseases such as rheumatic heart disease, coronary heart disease, peripheral vascular disease, even stroke, and deep venous thrombosis. So it is very much important to manage and to prevent the hyperlipidemia for the development of cardiovascular diseases. Now, as per our research question, we identified that why we have select the hyperlipidemia in context of cardiovascular disease, because the prevalence of cardiovascular disease is increasing day by day. And according to WHO, non-communicable diseases are estimated to account for 50% of total deaths. Upon them, only from cardiovascular diseases, the death prevalence is about 31%. So if we see that prevalence in context of Pakistan, so as a whole, there is 19% of cardiovascular diseases, but the probability is increasing up to 21%. And the highest responsible risk factor for cardiovascular diseases in Pakistan is hypertension, high blood pressure, which is about 41%. Obesity is 21%, high cholesterol 17.3%, and elevated level of lipid profile in male is 34% and in female 49%. So specifically, then we identified from the previous literature in Peshawar that the coronary artery disease prevalence have been increased since 1995 to 2004, 37%. So this is an alarming situation for our health scientists. So the same coronary artery disease in Peshawar prevalence in 2013, 23.6%. This is still a very high prevalence. Now, why we have choose the Ajwa date PETS powder? Because of their hypolipidemic property and which components on which bionatural molecules or substances responsible for the reduction of lipid profile in the blood due to Ajwa date's consumption. Any substances which is responsible for lowering our fats level, lipid level in our body, such as many fluoride, saponins, some.
I hope you can have him back. Now, because we lost Dr. Falak due to the internet disruption, I guess. So I would like to ask Dr. Falak if he is there, he can join us again and finish his presentation, which is half done almost. Dr. Falak, welcome back. So can you start your video? There we go. You're back.
Okay.
On.
Okay. Sorry. I'm so no sorry problem. For the inconvenience.
we expect these kind of situations. Go ahead, move on.
Okay. So I was talking about the different biological constituent of ajwa date pets powder, in which one is saponin. Actually, saponin suppress the pancreatic lipase, also inhibition of adipogenesis and appetite peptide. So these functions, it can reduce the lipid peroxidation. So another one is constituent of ajwa date pets powder is a resistant starch. The function is it can produce the propionic acid and also reduce the HMG-CoA reductase enzymes. This enzyme responsible for cholesterol biosynthesis. So resistant starch can reduce such enzyme through which it can reduce hyperlipidemia. Another one is low sodium and high potassium content, which is suitable for maintenance of our blood pressure. So through these biological functions, the constituent of ajwa date pets powder can reduce the incidence and also can prevent hyperlipidemia. Now the objective is to test the ajwa date pets powder efficiency in improving the lipid profile and the body mass index or body composition of patients with hyperlipidemia. So this study was a single blind randomized clinical trial which was conducted in Cardiac Rehabilitation Center of Hayatabad Medical Complex, Peshawar. And the duration of the study was 40 days. We intervene such product in the form of powder for 40 days. So we have included 40 patients with hyperlipidemia at the age range of 30 to 50 years, and included both male and female. Prior to study initiation, we have approved this study from the Institutional Research and Ethics Board of Postgraduate Medical Institute, Hayatabad, and this is the certificate. Also, we have purchased the ajwa date pets powder from King Saudi Arabia. And then we have tested and treated these products in the PCSIR laboratory in Peshawar for authorization. And further, we have processed the powder form in the PCSIR laboratory. Here is some glimpses. And then we have packed 2.7 gram of such powder in one sachet, and then they were packed and using a heat belt as a sealer. Now the data collection, we have divided the hyperlipidemic patient into two groups, and total individual was 40. And one group received ajwa date pets powder and also statin. Statin is a lipid lowering drugs in the form of atorvastatin. And also the other group was control, which received only the drug therapy, not the ajwa date pets powder. So prior to the patient enrollment, we have taken the written consent form in local language. You can see in the picture. And then these are some picture of the socket of such powder. Further, we assessed and detected the lipid profile, body mass index, blood pressure for each patient on the day of enrollment, after 20 days and after 40 days. And then the sample was bring such as serum sample, and their biochemical analysis was carried out in the laboratory of Hayatabad Medical Complex. These are some pictures of their individual reports. And further, we have applied 1 ANOVA and followed by a Toki post-heart test. And also for comparison between the two groups, we applied independent t-test. Here we have the results. So at the baseline, the characteristics of the individuals, including weight, fat mass, body fat percentage, and muscle mass, all other WHR, waist to hip ratio, these were all non-significant between the two groups. Now, after consumption of the Ajwa date fats powder, you can see that the ADP, Ajwa date fats powder, significantly decrease the weight of the individual, also fat mass, and also body fat percentage, along with a visceral fat area and the waist circumference of individual have been significantly reduced. In this slide, you can see the effect of Ajwa date fats powder consumption on the lipid profile. So only total cholesterol and low density lipoprotein have been reduced significantly at the day of after 40 days of the supplement consumption, while other parameters such
Falak, I think we have another problem again. Yeah, I think that's the problem.
strike lipoprotein.
Go ahead.
Hello?
Yeah, go ahead. We can hear you now. Go ahead.
Okay, sorry. So in this slide, you can see that the effect of Ajwa date fats powder on the blood pressure and body mass index. So only there was an effect, significant effect on the body mass index. So it means that it can reduce our weight. So the conclusion is that ADP significantly decrease weight, body fat percentage, visceral fat area, waist circumference, and fat mass. Similarly, significant changes was also reported in total cholesterol, low density lipoprotein, in BMI of the individual. So my recommendation is that individual with hyperlipidemia can use Ajwa date fats powder on regular basis at a dose of 2.7 gram in the form of powder with plain water. It should be taken along with the regular medicine, as this will contribute to fewer efforts on dietary interventions. And there should also need a further large clinical trials. So I acknowledge one of my student, Farha Riyaz. She conducted this research, and thank you so much for your time and for your patience.
Thank you very much, Dr. Falak, for being here. So the interruption went away. I'm glad that you finished your presentation. So
yeah, sorry. Thank you.
No problem. It was very beneficial, very informative for a short period of time. My dear viewers, as you see that Ajwa date powder is so beneficial that Dr. Falak, can you stop sharing your screen, because still I see your, there we go. Otherwise, we have to go to our next speaker, and our next speaker is going to be Dr. Sulaiman, and I'm sure he's ready, but wait for a few more minutes. And thank you so much for whoever attending this conference. As you see, it's very beneficial and very informative for everybody. And doesn't matter with age, which field are you active, but it's informative for everybody. And I appreciate all the speakers so far that they they have done a wonderful presentation. So I will try Dr. Falak again. Hopefully we can have him back. If not, I think we have an internet connection problem. Then we're going to ask Dr. Sulaiman to join us in a few minutes. Yeah, I think we don't have Dr. Falak with us anymore. So, yeah, it's around the globe. We expect these kind of technical difficulties. But I would like to introduce Dr. Sulaiman Abdullah. Dr. Sulaiman, by the way, before I introduce Dr. Sulaiman, also we had another speaker, Dr. Abdullah Muhammad Sohail, and due to emergency situation, a family emergency, he couldn't be with us, but he's listening. I think he had some difficulties, so may God make it easy for him. And we will have him next time, maybe one of these conferences. So now we're going to go to our next presentation, which is going to be Dr. Sulaiman, CT, a senior scientist, phytochemistry division, a center for medicinal plants research, Ayurveda, and is a Kerala, India. It's the city of Kerala, India. And the title of his speech is Scientific Validation of Traditional Purification Process and Anti-Cancer Activity of Semcorpus Anacardium. So Dr. Abdullah, thank you so much for being, and nice having you. Welcome to the conference.
Thank you very much, sir, and good evening to all from India. And I'm so elated to giving my this opportunity to share some knowledge regarding the Ayurveda, the Indian traditional systems of medicine.
Beautiful. Well, it's our pleasure having you here. Thank you so much. I don't know what time frame. I think it's over there. It's about 8 o'clock, right? 8 or 7.
Yeah, it's 8:30 p.m. here. Yeah.
Very good. Okay.
And I also extend my sin.
Dr. Sulaiman, nice to have you. I called you a little early, so I'm glad you're ready for that. So floor is yours. Please proceed. Thank you.
Okay, thank you, sir. And also extend my gratitude to Dr. Siddiqui, sir, for giving me this opportunity. So I am directly going to my presentation.
You're good.
Yeah, I think my
yes, nice
screen
presentation. Yeah, I
it
see.
is clearly visible. I think it is clearly visible.
Yeah, I can see your PowerPoint clear.
Yes.
Yeah, go ahead.
Yeah, so my topic is scientific validation of traditional purification process and anti-cancer activity of Semcorpus anacardium. It is an important medicinal plant used in various Indian traditional systems of medicine like Ayurveda, Siddha, Unani. So this is regarding the scientific validation of purification process, which has been mentioned in Ayurvedic classical texts. As we know, Ayurveda is one of the important traditional systems of medicine, which has been practiced in India more than 5,000 years. And it is unique among the various systems of medicine on different aspects, like including its time-tested practices, voluminous documents, and its ability to cope with the modern demands. And of course, medicinal plants are the major ingredients of Ayurvedic preparations. And there are a few animal origins, also metals and minerals are there, but maximum more than 80% is medicinal plants only, and which are safe. However, a few plants are toxic for human health. So these type of toxic plants are categorized as Visha, which means poison, and Upavisha, toxic but not lethal for human health in Ayurvedic ancient texts. And specific methods have been described to detoxify such drugs. In Ayurvedic classical drugs, this process of detoxification or purification is termed as Shodhana in Sanskrit, which is meant for the detoxification of medicinal plants before using it for medicinal preparations. And the Semcorpus anacardium, which is an important medicinal plant, which is in a Upavisha form, that which has some toxic compounds. That is why in Ayurvedic classical text, a specific purification method has been prescribed. It belongs to the family Anacardiaceae, commonly known as Bhalladaga in Sanskrit or marking nut in English. Is an important medicinal plant which is used in various traditional systems of medicine in India. The fruit of Semicarpus anacardium is used as either single drug or as an ingredient in many compound formulations to cure many diseases like nervous debility, rheumatism, epilepsy, asthma, and even cancer. The fruit of this plant in raw form has been reported to cause irritation, blisters, toxicity, and contact dermatitis. So various processes were described for purification of this plant in different classical Ayurveda texts. So in this work, the scientific validation has been done, the chemistry of purification, what will be the difference in the purified and raw sample, and what effect will be in the pharmacological or biological effect of these medicinal plants after purification. And mainly two different raws have been described in various classical texts, which includes various steps. And the method one will take at least 18 days for purification. And the second method is an even a simple method that also includes several steps for the purification of this drug. So in this presentation, I have termed the samples like SA1, which means the raw sample. SA2 is the purified sample by method 1, and SA3 is the purified sample by method 2. And here is the HPTLC comparison of various samples. And this is the raw sample. The first track is the raw sample, and this is the sample collected after the first step of purification, so and so, and this is the final purified sample. So here we can see that there are certain chemical compounds which has been eliminated even after the first step of purification. And there is some intermediate compound is formed at the third step of purification, but finally the same has been eliminated after the final purification step. So the HPTLC profiling clearly indicated that there are some chemical transformations are happening. Certain compounds have been changed into a new form, which show the spectrum and the RF value. So there are some chemical changes happening this purification process, and which was confirmed with the LCMS analysis. This plant contains fruit of this Semicarpus anacardium contains various forms of anacardic acid, that is anacardic acid monoene, anacardic acid diene, and triene. So see, this is the LCMS profile of various samples. The first one is the raw sample. Second and third are the purified sample by two different methods. So here, all the three types of anacardic acids were present in the raw and purified sample. However, the compound cardanol, which is present only in the purified sample. So this cardanol is formed by decarboxylation of anacardic acid. So this is a chemical transformation happened during this purification process. So this is the LCMS spectrum of cardanol, which was detected in purified sample, that is SA2 and SA3, which was purified by two different methods. So this is the chemical transformation of anacardic acid. By removing the carbon dioxide, the anacardic acid, some portion of the anacardic acid was converted into cardanol, which is less toxic in nature. If the anacardic acid is present in higher amount, that will cause the toxicity. That's why it needs a detailed purification process before using it for medicine manufacture. And also, you have done the toxicity and anti-cancer activity. So the acute oral toxicity study showed that the purified sample, which belongs to the category GHS5, that is the LD50 is below 2000 mg per kg body weight. So after purification, it didn't prove any toxicity in experimental animals. An anti-cancer activity of raw and both purified samples was evaluated in ascites carcinoma, that is an ESC tumor model in the experimental animals, which is a transplantable tumor model used to evaluate the anti-cancer effects of numerous substances, including natural products. And this is the result of anti-cancer activity. So here you can see the 5-fluorouracil was used as a standard, and this is a control group, disease group. So the treatment has shown a dose-dependent protection against ESC-induced mortality. And the purified sample, both purified sample at a concentration of 200 mg per kg of body weight, showed dose-dependent protection. So it increased the survival time by 58.2 and 59.5% respectively. So the detoxification process of this sample enhanced its anti-cancer activity comparing to the raw sample and also with the standard drug 5-fluorouracil. And in conclusion, the concept of Shodhana in Ayurveda comprises both process of purification or detoxification of physical as well as chemical impurities and minimization of undesirable effects, hence improving the therapeutic efficacy of the drug. The purification imparted chemical changes to certain compounds and enhanced the anti-cancer activity when compared to the raw sample. So it is evident that the toxic constituents are transformed into non-toxic form with greater potency. So the present study revealed that traditional system of purification can impact the chemical, pharmacological and toxicological profile of herbal drugs and is beneficial in increasing its safety and efficacy. And this is the scientific validation of a process which was mentioned in the classical text years back using the modern technology and scientific models. And it has been published in an international journal. And thank you for the patience listening. Thank you.
Thank you so much, Dr. Sulaiman, for your beautiful presentation, really beneficial. And actually, we learned a lot from this. Very organized, very nice. And thanks for participation. Also, I ask, may God help you guys and protects in India. Situation is not, I'm sure you're in Pakistan. So basically, there's a lot going on as far as this corona pandemic. So may God help and protect all of you. Stay safe and hopefully see you in the next conference sometime. Have a nice evening. Thank you so much.
Okay, thank you, sir.
Respected viewers and attendees, thank you so much for being with us. And there's a lot of information that we can grasp from it. And thanks again, Dr. Falak. So now, dear viewers, we are back to you, our attendees. So far, thank you for being with us. I hope you benefited so far from these presentation, very profound. And there's a lot of scientific researches and knowledge you can find for this short period of time. So anyways, now we're gonna move on to our next speaker. Our next speaker is going to be, I think we are a few minutes ahead of the schedule. Okay, yeah, I think we are good at that. So she's our next speaker, Professor Josephine Coswallo, PhD, affiliation, Makerere University College of Health Sciences, Kampala, Uganda. And the title of his presentation is Innovate Way of Developing Drugs from Plants in Low and Middle Income Countries. Dr. Professor Josephine, welcome to the program. I don't know if we have you or not. Let me see. Please, Professor Josephine, start your video, please.
Thank you very much.
Welcome to the program. Yeah, we can see.
Let me be seen.
There we go.
I think now I can be seen.
Thank you so much. Floor is yours. I appreciate it. I think you're a few minutes ahead of the schedule because there's some changes, but you're good. So floor is yours. Thank you so much for joining us with us.
I'm trying to share.
Yeah, we can
see my screen.
Yes.
I'm looking at innovative ways of developing drugs from plants in low and middle income countries. And I thought of this one because when you hear what other presenters have done, they have reached somewhere, but they have not reached the drug development level. And we are going to look at some of the challenges which we have been facing in trying to look at that. And when we are looking at, so my outline is I'm going to look at the introduction, developing drugs from plant material. I'm going to look at example of moringa or fela leaves. Shall look at challenges in developing drugs from herbal medicines in low and middle income countries, and then possible solutions. Communities in Africa and Asia and Latin America use herbal medicine to treat diseases. This has been going on from time immemorial. And the herbs are acceptable to people, while modern drugs are expensive and do not cure all the diseases. And they also have noticeable side effects after long-term use. Plants have phytochemicals that protect them from predators. And that's what we actually share as humans to treat some of the ailments which we suffer. For example, steroids, alkaloids, flavonoids, anthraquinones, saponins, to mention but a few. In fact, many of them have been identified, but we shall see some of the problems which are also faced. And these phytochemicals, they are antioxidants. They have hypoglycemic activity. They are antibacterial, antifungal, anti-cancer, and anti-inflammatory. But many of them are immunomodulators. The urge to develop drugs from herbs is very high. Isolation of active molecules and recombining them is not very successful. I think there are some phytochemicals which are already in the plant which have not been identified. But when you combine these molecules which have been identified, then they don't work as when all the plant material is together. And that one has also caused a number of problems, especially when it comes to pharmacokinetics, which makes it very, very complicated. It's difficult to follow a phytochemical. And then, especially those which are oral, then by the time they leave the GIT to join blood, they have changed into a number of different secondary metabolites. And that one very difficult to follow up to know which one is going to, how it's going to be distributed in blood or in the other parts of the body, and how it's going to be excreted at the end. So at the end of it, when you look at the way medicines are developed, you have to know the pharmacokinetics in order to use the plant for treatment. So let us look at drug production steps that can be adopted. Step number 1, we have to identify plants or a plant which local communities use for a disease condition. And once we have got that one, then we can also look at how do they use it. And then when we are developing drugs, we'd look at, try to mimic how they are actually using them. Then step number 2, look at establish the common phytochemicals they are in. Why I say common? Because there may be 1,000,001 inside them and you may not be able to identify all of them. So at least the known ones, if they are there, then that's good. Then the third step is to determine the LD50 or the acute toxicity. That one is going to guide what should be given and what doses, because most of the herbs which are being used at the moment, especially given by herbalists, the dose is not known. They don't know how much they should give. Some of them could even have worked much better, but because maybe the dose is low, and some of them become toxic because the dose is too high. And the fact that every chemical is poison depending on the dose, doses have to be very well calculated. Then the fourth step would be to determine the subacute plus or with chronic toxicity profile. That will help us to find out what dose does not cause any side effects only in the body. And then that one can be looked at and can be used to gauge what are the safe levels to be given. Then step number 5 would be to study the effects of the extract in disease animal models. Even sometimes when it has been done, then they say, oh, now look at bigger animals. However, we have got these small animals, especially like rats and mice. Their physiological parameters are close to those ones of humans, and even the enzymes which they have in the GIT are very close to the ones which are in humans. So those are very good species which could be used. And in developing countries, and we can always find rats. There are a number of rats, even wild ones, which we just hit and destroy them because they are bringing problems to or diseases to our communities. Then from there, we can produce or prepare to start clinical trial phase 1, because we have known the dose, we have known the toxicity levels, and we have prepared the extract which is going to be used. And clinical trial phase 1 would actually be looking at healthy volunteers who are willing to take the product. And the good thing that most of the time they have already been used in the communities and they already know it. So I give you an example of what we actually did when we are trying to look at Moringa Feller leaf extract to be used in the treatment of diabetes. So we started from step 5. We had already done step 1 up to step 4. Now, step 5 above was used to determine the hypoglycemic effect of Moringa Feller extract that could be adopted in drug development in LMIC. Moringa Feller is native to Asian continent and is now grown around the world. In Uganda, it was brought in 1900 when the Asians came to build the Uganda Railway. So they came with it. And I think it's one of well-studied plants, both in nutrition and also its medicinal values. Moringa Feller leaves are used in Africa and Asia to treat diabetes. And more than 20 studies have proved the hypoglycemic effect of Moringa Feller leaf extract in laboratory animals. We had to look at Moringa Feller because, some other plants which are being used for treating diabetes, the herbalists are not willing to let people know what they actually are. Some of them are known, some of them are still abstract. Despite of many studies being done on Moringa Feller, there is no drug so far being developed beyond that finding. And even what one of the previous speakers has said, he has now reached that level. When you reach that level, you have identified the phytochemicals, you have done even sometimes when you have done, let's say, clinical trial in patients, getting from there to produce a drug becomes a nightmare. So in our study, we used 24 female Wistar rats, which were aged 8 to 10 weeks. They are made diabetic using alloxan monohydrate. 3 groups of 6 rats each received one of the interventions once a day. One group received distilled water, 1 meal every day intragastric. Another one received Moringa Feller leaf extract of 1,000 milligrams per kilogram body weight, and then glibenclamide tablets, 0.04 milligrams per kilogram body weight. So fasting blood sugar was measured on days 7, 14, 21, and 28 of the intervention. So group results were compared on days 7, 14, 21, and 28 against the results of day 1 using the ordinary one-way ANOVA of starter. So levels of significance were fixed at less or equal to 0.0, 5. So this is one the graph showing the weight of the animals. Realize that when you look at okay, I hope it shows. When you look at the weight, the animals which received moringa extract and glibenclamide, there was gain of weight, but of course there was more weight gain in glibenclamide than moringa. The animals which received distilled water, which acted as negative control, by day 14, all of them had died. So that's where the graph why the graph stopped somewhere in between. So when you look at the mean fasting blood sugar, which was taken on every 7 days, you find that by the time we started the intervention, all the rats had blood sugar more than 300 milligrams per deciliter. And within the first 7 days, there was reduction in blood sugar in the groups of moringa and glibenclamide. And that one, they moved closely together. Day 14, moringa increased a bit, but was not significant. And the glibenclamide continued to drop, and moringa also caught up with glibenclamide, that by the day 28, both of them were at the same level. When I published this work, we were asked that we should break it down day by day to find out what actually happens. That work is not yet published, but we have done it, and we found that by the next day, both for glibenclamide and moringa, and we also used the metformin, we found that the next day the blood sugar had started reducing. And that one, I will not tell you the results. We shall get them when it's ready. So let us look at the results which we have got, show that the aqueous extract of Moringa oleifera has hypoglycemic activity in vivo. The effect is comparable to glibenclamide tablets. So actually the trends, they are moving together nicely. Existing phytochemicals can have good effect without isolation. So actually in low and middle income countries, isolating the phytochemicals and then recombining them, we shall not manage to do that. So yet, even when you don't isolate, you get very good effect. So we have to find out how can we now promote the use of these extracts when we have studied them properly within all those 5 stages up to the time when we come to clinical trial, phase 1, and then we go through all the clinical trial phases up to 3. And then we see what actually happens, rather than thinking that, being blocked, saying that you must isolate, you must do this, and you must do the other. So herbal medicines can be standardized with minimal resources. So we can actually benefit from that. So in conclusion, crude plant extract can be used to develop drugs to treat chronic diseases that have no cure. So using crude extracts will hasten the production of drugs from plant material. So low and middle income countries can benefit from the abundant medicinal plants which are available. So now let us look at the challenges of developing drugs from herbs in LMICs. So there is low technology adaptation and availability. There is a lot we'd like to do, but we cannot do it. To do the isolation, to do the recombination, because even those people who have those technologies, they're also finding it a bit difficult to develop as many drugs as possible to be put on the market. There is also inadequate support by governments and medical personnel. The governments are not putting in money to develop drugs from herbs, and medical personnel are not willing to have these herbs in the hospitals, even when they themselves actually use them at home. But when it comes to hospital, that's no go. Then the pharmaceutical industries are not willing to support development of herbal medicines, especially when we are using extracts, because they will not be in control. They would like somewhere where the molecules have been, isolated, they combine them, produce as much as possible, yet this one will remain the domain of the people who are cultivating it, like the presenter from Afghanistan who said they're exporting, you export them, those people, they use it when you have added minimal value to it. Yet if we added on value, maybe if we started exporting extracts instead of just the plants themselves, the herbs. So many herbalists are not willing to reveal their secrets on herbs. So we have to find a way of entering into that domain. WHO guidelines are silent on the need for pharmacokinetics in medicines. That's what the pharmacologists, the pharmacists, and the pharmaceutical industries are actually using, so that when you don't know the pharmacokinetics, how can you use that one in treating people? Yet when you look at plants, they have got a number of phytochemicals, which makes pharmacokinetics more complicated. And let's look at some suggestions to overcome the challenges. One of them is collaboration between developed and LMCI researchers on herbal medicine should be actually strengthened. Maybe if we have got a collective voice, then maybe we can have something coming out of it. More advocacy on the use of evaluated herbal medicine in hospitals. I think we should also promote that, because some people leave hospitals when they have actually failed to get, proper treatment. And when they use those herbs, they actually do well. So policy guidelines on use of herbal medicines at all levels should be strengthened, both at international level, at a regional level, and also at country levels. And also, we should also build trust among herbalists and researchers, whether through advocates. I mean, the trust is not there. The herbalists think that the researchers are trying to steal away the domain which they got from their parents. There should be deliberate effort to put funds into herbal medicine research from international donors and pharmaceutical industry. So cheaper technologies should be developed. I acknowledge Makerere University, the Carnegie Corporation of New York project, and the Makerere College of Health Sciences for support, and the Department of Physiology for lab. Those are references. I thank you very much.
Thank you, Professor Josephine, for your beautiful presentation. And I hope you have a great evening over there. I don't know what time is in Uganda right now.
It is 6:something, 6:35.
Enjoy the rest of your evening. And I appreciate your attendance. Hopefully we have you in the future programs and events as well. You have a nice day. Thank you so much.
You are welcome.
Appreciate it.
Now stop sharing.
There we go. So, anyways, we want to move on to our next speakers. Our next speaker is Dr. Vivek Sharma. The title is Cytomorphological Evaluation, Phytochemical Characterization, and Bioactivities of Vernonia amygdala deli. I'm sorry about terminologies and these special words. And this is from Himachal Pradesh. Affiliation Associate Professor Botany, Medicinal Plants, Department of Botany, Eternal University, Baru Sahib District, Saimur, in Himachal Pradesh. So correct me, Doctor, as far as my pronunciation. I apologize for that. So we want to go back to.
Start my video.
Yeah, I see your video now.
And right now, going to share
yeah,
screen
I
also.
see, I see it now. You're good. Okay. Yeah.
Okay.
Yeah.
Now it's good, no?
Yeah, you're good. Move on. Floor is yours. Thank you.
Okay. Okay. Thank you. Thank you.
You're welcome.
Thank you very much.
Sure.
So, first of all, very good evening to all of you, especially the Habib Muhammad, as well as all the, I mean to say, the secretary, as well as all the authorities of this particular conference. And I am Dr. Vivek Sharma, and I am from India. So the topic of my research and whatever I am just going to deliver today, that is on the basis of different parameters. The topic is cytomorphological evaluation, phytochemical characterization, and bioactivities of Barnonia magdalena delisle from Himachal Pradesh. So first of all, I would like to tell you that this Himachal Pradesh is one of the state of India, and particularly the northern Indian state, where we have collected these plant and then do each and every aspect of this particular plant, which is one of the most important medicine plant of this area. Next. Is it visible, na? Okay. So as per the introduction is concerned, I would like to tell you that medicine plants, as we know, play a great role in conventional medicines, as also in trade commodities also. So when we are talking about the Indian medicine plants and all that, I would like to tell you that Indian medicine plants, they have a very vast, I mean to say, the distribution of these medicine plants. About 70% of the medicine plants are India are wheeled in tropical forests in eastern and western Ghat, particularly Aravallis, Vindhyas, and Himalayas and Kashmir also. So India has different position in the world where traditional system of medicine like homeopathy, Ayurveda, yoga, and naturopathy, they are very commonly available and very popular here in India. So when we are talking about the Ayurveda, everybody know that it is one of the foundation stone of medicinal, and we can say the medical science of India also, as well as the medicinal scenario of India. So as we are talking about the plants which are bitter in taste, anti-helminthic, anti-periodic, anti-cancerous, blood purifier, and carminating. And few of other speakers, they have already told different medicine plants and the history, as well as the different aspects of those medicine plants. So just like that of the Moringa oleifolium, as I am just after that delivering this particular topic. So here again, only in few lines, I would like to tell you about the introduction of these plants. So this particular plant, which is used for the treatment of skin diseases, urinary infections, bronchial asthma, as well as the weakness of the digestive system, loss of appetite, and many more. So when we are talking about the India, there are 16 agroclimatic zones. About 45,000 different plant species are widely used in the preparation of the drugs here in India. And different drug manufacturers, they are working on these medicine plants and prepared a lot of different herbal drugs on the basis of these plants. So whenever we are talking about the medicinal richness of the species, this particular plant that is called as the Barnonia magdalena has been selected for further research and development. So there are so many different questions why we have selected this particular plant. I'll tell you later that why we have selected this plant for the research and other parameters. So this Barnonia magdalena is a African anti-diabetic medicine plants, which is now growing all over the world. And here in India, it is prominent and distributed here and there at I think in each and every state of India, particularly northern region of the India. So this Magdalena is commonly known as the Nadol and African bitter leaf due to its bitter taste and flavor. So when we are talking about the classification of this plant, Barnonia magdalena, everybody know that this is the kingdom, division, class, and then family. It belongs to the Astaceae family and the genus Barnonia, species Barnonia magdalena. So a lot of different common names are there: bitter leaf, Nadol, Pocock, Bismillah, Sahadevi, Sahagai, Shuthai, Editot, Omugubu, Klusor, and many other names are commonly given to this particular Bernonia magdalena plant. So as we are discussing about the distribution, and when we are talking about the distribution of this plant, so I have already told you that it is the African plant, basically from Africa, and now distributed here and there in every, I think, country of this world. So occur temperate area of Asia also, but the genus is also common in Europe, North America, and even in Nigeria also. So Bernonia contain more than 1,000 species, in which more than 500 species are spread in Africa and Asia. 300 species of this plant are widely spread in the Mexico, Central and South America, and nearby 16 species are found in the United States of America. For present study, here the species has been collected from various areas of Himachal Pradesh, and some plant species, or some, we can say, some plant accessions we have also collected from one another state that is called as the Punjab. Here I would like to tell you that both these states, Himachal as well as Punjab, they are from North Indian states of India, and particularly the reason to collect some plant from Punjab is only to go for the comparative parameters. And later on, I'll tell you that what we have got after the comparative analysis of these plants when we collected from the various regions. So I have already told that this plant is anti-diabetic, antioxidant, anti-helminthes, and anti-malarial, even anti-cancerous and anti-allergic and antibacterial activities also found here in this plant. So when we are talking about the Scandi metabolites, almost all the Scandi metabolites are present here in this plant. And now the question arises, why we have selected the plant Bernonia magdalena for the study. When we are talking about the Bernonia magdalena, and when we see different parameters just like that of the ethnobotanical role of this species as anti-diabetic, we found that particularly some of the tribes, they are using the leaves of these plants for the anti-diabetic activities, and very promising and very attractive, and we can say very good results they have found. So to check the D-amygdalin, one more thing is there, that is vitamin V17. Everybody know vitamin V17, it is the D-amygdalin type of the components, and particularly these type of components are found in the prunus type of the species, but here we have find out first time the vitamin V17 due to amygdalin type of compound found. That's why I think the name of this plant species has been given, that is Bernonia magdalena. And some other polyphenols in various successions of this species, and the linkage with antioxidant, anti-cancer, anti-diabetic activities, that should also be checked, and that's why we have selected this plant here in India to go for the further research. And then different microbial stains activity and its efficacy against those microbial stains should also be checked. And till today, very small, I mean to say very few reports are there where they have checked this antimicrobial type of activity for this plant. Further, the future role of this plant species herbal formulation is very much important, and I would like to tell you that one particular herbal formulation we have also prepared after that, and that is also a part of patent in near future, and we are also planning to develop that. So these are some of the objectives, and I don't want to share all because everybody know that to collection of the germplasm and then go for that of identification on the basis of morphometric factors, preliminary phytochemical analysis, and then qualitative and quantitative analysis with the help of different reverse phase HPLC PDA method. And then in vitro biochemical activities like antioxidant, antimicrobial, antidiabetic has also been done on this particular plant species and its different extract also. So here I would like to tell you, this is the Himachal map of Himachal Pradesh, one state of India, and these are the, and side by side I would like to tell you that Ludhiana and Dhameta, these are the two different villages. One is from Himachal Pradesh and second one is from Punjab. And these are, I think, this towns where we have collected these plant species and go for the comparative analysis. And then after here you can see the picture of this particular plant, Bernonia magdalena. It is perennial shrub, soft wooded plant, and height 2 to 6 meter. So it is not a herb, it is a shrub. And everybody should know that due to these white flowers and the genus name after the English botanist William Vernon, and he particularly gave the name to this plant Vernonia magdalene. So on the basis of this Vernon, the name, the genus name has been given Vernonia to this plant. It has dark green leaves and rough bark. The stem of Vernonia temporarily forked and treated with film pith. Leaves are alternate ovate and ellipse in shape also. The inflorescence of Vernonia magdalena flower is terminal and compactly formed with small bracteoles. So a very interesting plant and very beautiful. I mean to say that very beautiful shrub it is, and which we have collected and introduced into our own botanical garden at our own university, Eternal University, Badu Sahib. So different morphometric characters also showing different type of the characters. I don't want to discuss these morphometric characters because they are very common characters which we have find out, but only very few, some sort of I mean to say the differences which we have find out, but on those differences we can't say that there are some morphometric characters or morphotypes available. So when we are talking about the cytology and different Carnot's type of fixity we use, and then go for the acetocarmine techniques to prepare some of the slides and then analyze those slides, and we found that the chromosome number of this particular these are the chromosome numbers, and these are the chromosome which we have find out after going for the cytological analysis of this particular plant species. So it is tetraploid number, and you can see 2n is equal to 4x is equal to 36 with basic number n is equal to 9. And here you can see the chromosomes at metaphase 1 stage. So then we follow the preliminary phytochemical analysis on both the accessions, one from Himachal and other one from the Punjab. And after going all these tests, I don't want to discuss again all these tests because these are again very common tests and everybody is going on right now. So here you can see that some leaf, stem, leaf and stem. Leaf and stem from Himachal Pradesh accessions, and the second one from the Punjab accessions. And when we compared all those, almost all the Scandi metabolites they are present, except coumarins. And but again, I would like to tell you that these are only the basic preliminary quantitative phytochemical screening, and we don't go for any final results that which one components are present or which one are not present there. So then phytochemical investigation with the help of HPLC PD analysis has also been done on accessions from the Himachal Pradesh. Now we have focused only the accession which we have collected from Himachal Pradesh and one of the state, and we have just simply discard the second one accession which we have collected from the Punjab after going into after consulting all the morphological, cytological as well as the preliminary analysis. We find out that this particular accession is very much important, and there are some differences, and we have find out, and that's why we have chosen it for the further analysis. So here you will see that some of the polyphenols, because Vernonia magdalena is one of the component, magdalene is also one of the component, and the properties of these particular plant species are on the basis of polyphenols. So three different polyphenol, the rutin, syringic acid and epicatechin, we have purchased and used as a standard, and on the basis of these standards we have prepared the sample solution, we have prepared the standard solution, and then we have prepared one methods, and these are the instrumentation and chromatography conditions which we have followed. And you will see here that isocratic elution 70-30 with pH 3.2 which we have maintained with the help of 0.3% acetic acid, and the mobile phase is methanol and water. The flow rate 1.0 at 2200 psi which we have used, and all these three components or we can say the standards we have analyzed at the wavelength lambda 280 nanometer. with the help of photodiode array detector. So these are some of the instrumentation. So here you can see the three different routines, syringic acid and epicatechin, the chromatogram of these standards, and simultaneously the calibration curve of these standards are also available. And here you will see the results. And here I would like to tell you that in case of the leaves and stems, so leaves contain higher amount of rutin, higher amount of syringic acid, higher amount of epicatechin as compared to that of the stem. So again, here we can make only a very small conclusion that leaves are very much important than that of the stem, because they contain higher amount of Scandi metabolite, particularly the polyphenols, as compared to that of the stem. So next, again, we have calculated, or we can say the analyzed diamygdalin in the particular plant sessions which we have collected from Himachal Pradesh, one of the state of India. And again, methanol water 20 ml we have used for preparation of the sample solutions. And then after sample solution, again we have prepared the standard solutions with the help of 1 milligram 2 ml of the standard solutions. Methanol water, again we have used 50-50 ratio, and then 1, 2, 3, 4, and 5 microgram per ml of the standard 5-point calibration curve we have again prepared. And here again the instrumentation, particularly for this Vernonium amygdalina, and to analyze particularly the amygdalin type of the component, which is one of the standard. And I thought that due to this standard or due to this component, the name of this particular species has been given. So again, the calibration curve and role of amygdalin in cancer treatment. Why this is more important, and because of the role of this particular in cancer treatments. Here you can see some of the cancer cells, and then oxygen benzoaldehyde and regulate blood pressure, and even production of the V12 and benzoic acid. So this is one of the we can say the different type of its parameters on the basis of which we can say that amygdalin is used as a cancer treatment also. So here the chromatogram of the standard diamygdalina, and again the calibration curve, and again you will see in leaves the amount of amygdalin 271.62 milligram per 100 gram, which is huge. And that's why this plant species is very rich in the amygdalin type of the component. And it is one of the basic component, or we can say it is one of the most important active ingredient found here in this plant species. And particularly the amount has been recorded maximum in leaves as compared to that of the stem part. So the next bioactivities, three different parameters we have followed for analysis of antioxidant activities: DPPH assay, 2,2-diphenyl 1-picaryl hydrazine assay, then ABTS assay, and then FREP assay, ferric reducing antioxidant assay. So these are the three basic antioxidant, because if we in previous study we find out that there are a lot of polyphenols are present. So if there are polyphenols are present, so definitely it also shows some of the antioxidant which is correlated with that of the anti-cancerous type of the activities. So here I again don't want to go for the principle and chemical used. It is the very common process and DPPH assay, and here is the procedure of that DPPH assay. But the results here you can see at 1000 microgram per ml of the concentration, the percentage inhibition of standard, and we have used ascorbic acid as a standard here. You can see at 98.78. This is the standard percentage of standard when we are going for the DPPH assay. And here you can see the leaf extract, which is again showing approximately 72.74%. So it means against the standard, our plant species, particularly the leaf extract, showing a very promising result, 72% approximately the antioxidant activity with the help of DPPH assay. So here you can see the stem 64. There is 10 digit I think numbers of difference between stem as well as the leaves. Again, leaves are showing better results. This is the second one, antioxidant activity. And here the procedure, I don't want to follow the procedure right now and don't discuss it because time is very limited. And here the concentration, again at 1087%. Here Trolox is used as a standard. And again ABTS 64%. In STEM, it is 56.81%. FREP, again, the last one, that is the FREP. Here you can see again the FREP ascorbic acid showing 98 point approximately percentage of inhibition. Simultaneously 63% we have find out in leaf, and then 55% in case of the stem. So after analyzing the antioxidant activity by 3 different activity procedures, we found that DPPH is one of the best. Hello.
You're
Hello.
there. Yeah, we can hear you.
Okay. So next one is the antimicrobial activity. Again, dicrystin S is used as a standard to analyze the antimicrobial activity of these particular plant species. And here I would like to show you only the results. And you can see here against Staphylococcus aureus, it is showing the leaf extract showing approximately 10.02 millimeter of the diameter when we are using 100 microliter of the leaf extract. And simultaneously you can see the standard, the amount of standard 50 microliter we have used, and the diameter which we have find out after analyzing and against the Staphylococcus aureus. So 4 different microorganisms we have used: Bacillus subtilis, Staphylococcus, Pseudomonas, as well as E. coli also. And here you can see the stem extract, which is not much more. There is a difference we have find out, but still it is lesser as compared to that of the leaf extract. Here you can see the standard, and some diameter we have find out here at 100 millimeter, and Vernonia magdalena showing some zone of inhibition, as we can say that it is against the 100 microliter of the dose against Staphylococcus aureus. So then anti-diabetic activity has also been in vitro anti-diabetic activity has also been done on this particular plant species and its extracts, and which is called as the inhibition of alpha amylase enzyme and inhibition of alpha glucosidase enzyme. So these are the 2 parameters which we have find out and done on this particular plant. And here on the basis of alpha amylase inhibition percentage, we can see that standard drug Carvos is used, and after Carvos the mean standard deviation and results which we have calculated here, they are in the mean standard deviation. And Vernonia magdalena leaves again showing 58.93% of inhibition. In case of stem, it is 32.11%. And when we are considering it against the standard, you can see here 85%. So again, leaves are showing the better results in when we are using the alpha amylase type of inhibition. So when we are going for that of the alpha glucose inhibition,
Dr. Sharma, your video was off. Are we almost done, because we are within the time frame, so we should conclude. Thank you.
Okay, no issue. Thank you very much for giving me this time. And ultimately, this is the last one, that is the conclusion. And thanks a lot. Thanks a lot, Habib. Thanks a lot.
Sure. Thank you so much for your participation. And I wish, I don't know how is the corona situation over there. So can you tell me what's the update over there? So things are under control a little bit, or?
Right now things are under control, but still the death rate is not under control right now. So the number of cases are nowadays reducing day by day, but we are much more concerned about the death rate.
Okay, we pray for you guys, and I hope.
Yeah, sure. The pray from you as well as from each and every community of this world. That is also, I think, the need of all.
Thank you so much for your presentation, and I hope
thank you.
Next
thank you.
conference as well. Have a nice day.
Thanks a lot. Nice day to you.
You can stop your slideshow. We can, Thank you so much. So this was Dr. Sharma with his very beneficial presentation. So the last guest, the last speaker we have for this session is, this is Dr. Abdul Rauf. And we have Dr. Abdul Rauf, I think, yeah, he's there. So the title is Scope of Ibn Sina's, known in the West as Avicenna, Cardiac Medicine and Healing Psychological and Cardiovascular Diseases. So his affiliation is Department of Ulum Adviya Ajmal Khan, Tibia College of Aligarh Muslim University in Aligarh, India. So without further ado, we want to Dr. Abdul Rauf to start his presentation. Dr. Abdul Rauf, you can start your video right now. Can you hear us, Dr. Abdul? Oh, very good. So now I see you over there. Welcome to the conference, Dr. Abdul Rauf. Assalamu alaikum. Yeah, you have to just unmute yourself. Your mic is off. Still you, okay. Still you mute. So if you can just click the mute button, should be okay, but still you're in mute position. Can you try again? And the mic is actually, I can see your picture, but I can hear your voice. So try it again, hopefully. There we go. I see the presentation, but I don't have your mic on. So without mic, you can't do the presentation, Dr. Abdul Rauf. Let's fix that one first. So you have to unmute yourself, please. You still see, I ask you to unmute yourself. Did you click your?
Hello.
Oh yeah, I can hear you now.
Am I audible to all of you?
Yeah, now it sounds clear. Yeah, that's fine.
Very good evening to all of you, and my salam and peace to all of you.
Thank you so much. The floor is yours, and you're our last speaker for this session.
Okay.
You can move on to
Okay.
the presentation. Thank you so much.
Okay. Okay. Please wait. I am trying to upload my slides.
Okay. What time is in Aligarh right now?
Right now, it's 9:43. 9:43 p.m.
Very good.
Okay.
Yeah, I can see your screen right now, so you're good to go.
Okay. I'm trying to share my slides. Okay, please wait.
Respected viewers, as you see, we are working around the globe, and these kind of difficulties and technical issues always there. Yeah, we can see your screen. Yeah, we see the Zoom screen, but I don't see your PowerPoint.
Yeah.
Okay.
Am I audible?
I just see more than meeting. That's a Zoom. You have to switch it to your PowerPoint.
Yeah, am I? Okay.
If you get out of this screen and
Okay.
No.
Let me please
Yeah,
wait for some time. I am trying to join. I have
yeah. Close close this screen, and I think that should
Should
do
I
it.
close the screen?
Yeah, there we go. Now I see it. You're good now. Okay, Dr. Abdul, you're good, and you have 15 minutes. And you're the last speaker.
Yeah, yeah.
Yeah, I can see it now. Very interesting subject title. You can start now. You're okay.
Okay. Are you looking my slides?
Yeah, I can see it. Yeah, I see PowerPoint.
Yeah, you are looking my slides?
Yeah, I can see it. Yes, you're okay.
Yes. So I can start now?
Yeah, you can start. Floor is yours, Dr. Abdul. Yeah.
Okay.
Here we go. Yeah.
Yeah. So I am going to start my presentation.
Yes.
I think all of you are comfortable and you are listening my voice and looking my slides as well. Yeah. A very good evening from India to all of you. Myself, Dr. Abdul Rauf, representing from Aligarh Muslim University. I am an associate professor and the chairman of the department of Latia, which is located and affiliated from Aligarh Muslim University, Aligarh. The topic of my today's talk is the scope of Ibn Sina's cardiac medicine in the healing of psychological and cardiovascular diseases. As everybody knows about Ibn Sina in Europe, he is known as Avicenna. He wrote many books on different subjects like medicine, physics, astronomy, geometry, history, and astronomy, and so many other. He is the great thinker. He is the polymath of his medieval ages. So apart from the very famous and authentic book of Al-Qanun that was written by Ibn Sina, another important treatise is written by Ibn Sina, that is the Risale Adbiya Qalbiya. Risala means treatise. So this treatise is written by Ibn Sina. It is the most authentic and original research work of Ibn Sina after its world famous book Al-Qanun 15. A very famous book was written by Ibn Sina that is known as Canon of Medicine in English and Al-Qanun 15 in Arabic. And this book was taught as a textbook in Europe for 4 and 5 centuries. Up to 17th century, it was taught as a textbook in European countries before Renaissance. So it is a very important book. And after the Al-Qanun, the other important book that was written by Ibn Sina is the Risale Adbiya Qalbiya. It has very much importance as it was written in, at that age. Now it has very importance because it covers the matter related to the cardiovascular system as well as the psychological illnesses. The psychological illnesses basically it gives a lot of pressure on the cardiac element. Basically, you can say it is one of the most important factors. Psychological states are one of the most important factors that cause the cardiac diseases. So Ibn Sina discusses elaborately. Ibn Sina describes describes elaborately the relations between the cardiovascular diseases and the mental illnesses. So it is if you see the books that was written by the Iranian scholars, that was written by the Arab scholars, they followed the alphabetical pattern, like from A up to Z, from Alif to Ya. So Ibn Sina also followed this pattern while writing the medicine in his book. Before Ibn Sina, no physician has dealt with the drug for heart ailment in an independent way. If you see the history of the books that were written in the medieval ages, you cannot find any physician, any genius person that has written up an independent book on a cardiovascular as well as the psychological state. It is the honor and distinction of Ibn Sina who has written this book 1000 years back. So Ibn Sina had not only laid the foundation of arranging simple drugs by describing the only cardiac medicine in his book Kitabul Adwiyat al-Qalbiyya, but had given the proof of his intellectual ingenuity and medico-technical creativity by selecting the very important organ, that is heart. The treatise in cardiology, that is Kitab Adwiyat al-Qalbiyya. In the present time, the heart diseases and mental ailments are particularly counted among the diseases which have become common and which are considered as hazardous for the human life. Despite the tremendous development in cardiology, ischemic heart disease is still posing a challenge to the medical fraternity. Everybody knows. It is a general perception that the concept of cardiac disease does not exist in the old literature. This is my aim to highlight the concept of cardiac disease that was written in Ibn Sina. It is the legacy of Ibn Sina. It is the legacy of the physicians of the medieval ages that they also highlighted 1000 years back the importance of cardiac diseases, the impact of psychological behavior on the cardiac diseases. Contrary to it, the concept of cardiac disease prevails since ancient period. Most Greek scholars elaborated the full description of cardiac diseases in their treatises. Ibn Sina has the honor and distinction to be the first to comprehend the necessity of exclusively working on the medicine for heart ailment more than 1000 years ago. This Risala deals with 63 single drugs and 17 compound formulations to which he claims they are useful in cardiac and mental disease. He mentioned only 63 single plants, not only plants, but you can say single drugs that comprises of botanical origin, biological origin, and mineral origin, and 17 compound formulations as well. It is a veritable treasure true and promising hypothesis and agent for cardiovascular and psychiatric diseases. The information that was given in the book is authentic, it is comprehensive, it is well arranged and unburdensome, unlike most such compendia that was written in that age. This Risala is considered to be the greatest demonstration of the impracticality of the author, describing the treatments tested originally by Ibn Sina himself and showing the high efficacy in the difficult area of cardiovascular drugs and the psychiatric illnesses. This book, the most important point I should highlight here, this book introduces the nexus between the mood, brain, and the heart, particularly in the form of the drugs that improve both cardiac and psychological pathology. In COVID period, we are looking so many patients who are suffering from the COVID, from the mild symptoms of COVID, but they, due to their great stress on their body, they are putting a lot of stress on the heart, and that is why they are suffering from the cardiac arrest. So Ibn Sina states that the psychological stress gives the pressure to the heart, which is the leading cause of the heart. So he describes the medicines which are equally effective for the cardiac disease as well as the mental illness. Ibn Sina also brings in the theory of 4 pillars and the corresponding humors and their qualities. the four qualities like hot and cold and dry and wet. And this particularly mentioned that the roux, the pneuma, roux is made from the subtle part of the humor. It is a very important part that of the humor. So, for instance, if depression and cardiac weakness has arisen due to increased cold in the roux, in the pneuma, a hot drug like ambergris, a very important medicine that is used in a traditional medicine, will improve both diseases by offsetting the abnormally increased cold. The humors and qualities are generally known, but the author has gone ahead to mention the subtle physiological component and show the relatability of subtle with the non-local mind and physical heart on one hand, and with the physical drugs on the other hand, by means of quality. Ibn Sina described total 17 discourses in this book. First 13 discourses are dedicated to basic discussion about the conditions related to the heart and some cardiac diseases. In these chapters, Ibn Sina described physiological, mainly cardiac causes of different emotional states. Particularly, I should like highlight these particular aspects. To have different emotional states and application of pharmacotherapy to manage them. The chapter 14 consists of 63 detailed monographs and single cardio active drugs and their therapeutic effects. The final chapters appertain to compound cardiac remedies. This kind of discussion are lacking in the contemporary physicians of Medina and even in the literary scholars. You cannot see this type of description of that the book that was written in the 1000 years ago, and even it is the honor of Ibn Sina only, and you cannot find any other pattern of even in the literary scholars. 9 of this chapter deal with the psychology, which give the detail about the pneuma, its sign, seed, and its extroverts and introverts. This treatise is not restricted to just function and properties of cardiac drugs, but also establish the relation between the human psyche and medicine. Very important. He has established the relation between the human psyche. He particularly asserted that the human psyche put a lot of pressure, put a lot of significant effect on the heart. And he also described the medicine which are equally effective in psychological disorders as well as the heart diseases. To further, not only the connection of all psychic states like anger, anxiety, happiness, sadness, and other feelings in the heart, the kind of blood and fluids of the body, have been discussed, but their treatment are also suggested that these psychic disorders can be treated by pharmacological means. So, Ibn Sina states, in such cases, you have to treat the psychological and emotional state followed by the treatment of the cardiac diseases. Ibn Sina suggested various psychical states such as anger, anxiety, joy, grief, vindictiveness, and other feelings governed by the structure of the heart, as if it is a repository of divine potentiality, the constituents of blood, and other humors as well as humor. He was probably the first physician who correlated the heart with psychological state. In the words of Ibn Sina, particularly, I am putting an emphasis on that sentence that is given by Ibn Sina. In the heart is the origin of vital. This is the theory, and we should understand this phenomenon, and we can treat by focusing, by emphasizing on this particular sentence. The heart is the origin of the vital state, that is human, which itself is the source of emotional states such as happiness, grief, fear, and anger. Therefore, the quantity and quality of vital spirit plays an important role in existing of such mental states. Large amount of humor, its moderate viscosity and excessive glitter can give rise to extreme happiness, whereas small quantities of humor can cause grief and unhappiness that leads to the psychological followed by cardiac disorders. A large amount of humor itself originates from the moderation in the blood volume, viscosity thus is happiness. Moreover, a viscous, turbid, and a very hot temperament tempered blood can result in grief, while a thin and hot blood induces anger via their effect on the vital fluid, that is pneuma. In the 14th and 15th chapter, he described simple active compound drugs, remedies of the heart. These categories can consist of stimulant, diuretic, and cooling agents. Apart from 63 single drugs, we discussed the compound drugs in the form of electuary, crushed medicaments, pills, tonic, and syrup that are derived from the vegetable, mineral, and animal kingdom. This treatise the precious source of novel hypotheses for researches on psychosomatic aspects of cardiovascular diseases, as well as phytopharmacological studies on cardiovascular medicine plants. These are the list of the single cardiac drugs that is mentioned by it. These are the 63 single drugs. We have written here the common name, the scientific name, and the Arabic name. We have enlisted the 63 drugs like this. So you can see all these 63 drugs that are mentioned by Ibn Sina, about which Ibn Sina states that they are effective as cardioactive drugs, and they can be used for treating the various emotional states followed by cardiac illness. So, since I belong to a department where we study on a number of medicine plants also that are used in a traditional razor, that are used in a system of medicine. It is also known as Greco-Arab medicine. So we have our department carried out a lot of researches on the drugs that are mentioned by Ibn Sina. So we have carried out some of the effect of cardioactive effect of the cardiotonic effect of the drugs that are mentioned by Ibn Sina, like amla, that is the Empirica officinalis. We have carried out. It produces a little fall in the blood pressure of an exercise dog at a dose of 100 milligram per kg. This high potency effect of the drug was neither blocked by atropine and nor by antidote. It showed cardiac depressant effect on normal isolated frog heart at the 2 to 10 milligram and complete heart drop at the higher. It produces stimulating effect on hypodynamic frog heart in vivo and in a dose of 20 milligram. And other medicine like Kahruba, like other Utras, we have also studied the cardioactive effect, the antidepressant, the cardiac depressant effect, the hypotensive effect, the and other effects on the frog heart in vivo and in vitro. And these are the various scholars that they had carried out a lot of researches in 1975, 1979, 1981, and so many. And these are the various scholars of our department. They had carried out the work on these drugs. These are the phytopharmacological and pharmacological studies of Jadwar, that is delphinium. This drug is also mentioned by Ibn Sina. The study was conducted and done in our department by extracting the single drug that is produced the stimulant effect as it is educated by Ibn Sina. And the other drug, that is the Behmansur, Salvia hematodes, it is also mentioned by Ibn Sina. We have also conducted the effect of the drug and we found in consonance as it was described by Ibn Sina. The another drug, that Tirsa, that is iris insata, we have also studied the cardiovascular and antivetum and cardiovascular effects. And we found that these drugs also have potential effect on the cardiac drug and antihistaminic effect, and it is also equally beneficial in the psychological states. The physicochemical and pharmacological studies of this Polypodium vulgare, and this drug is also mentioned by Ibn Sina. And this the antimuscarinic and antihistaminic activity was ruled out as the aqueous extract failed to inhibit the action of acetylcholine, histamine, and the smooth process of intestine, frog heart, and the dog blood pressure. This is the scientific evaluation of certain high potency drugs like Terminalia arjuna, it is and Abhal also, Juniperus communis is Abhal, and this Abhal is also mentioned in the Kitab Al-Biya. Now we are coming the comments and the interpretation of these drugs, because while looking on these the materials that is mentioned by Ibn, we cannot arrive to a conclusive point. So we have certain comments and interpretation that should be correlated while reading and studying the book. The correct understanding of classical supramaterial based pathophysiology and pharmacology of traditional medicine, as well as demonstration of molecular effects of the classical herbal drugs and multi-herbal formulation to exist, which can help and assist for greater understanding of the ways in which herbs can facilitate health and restore balance in the disease. The drugs mentioned by Ibn Sina as cardiotonic need a careful pharmacological and clinical evaluation in the light of modern methods of investigation. A possibility of error of interpretation exists around the result. Therefore, these interpretations should be given due consideration while starting any modern research on these drugs. A careful study of whole facts gives the reader insight into the humoral, holistic mode of cardiac patient, the drug, type, personal, and environmental adjustment. For example, if a patient happens to have pure blood of normal concentration but has excess heat, the drug to be prescribed must be of cold temperament. The idea of quantity and quality of pneuma, temperament, its consistency, and its radiance are very peculiar to the mode of supramaterial and intuitive thinking of classical time. It is difficult to equate them with modern analytical, experimental, and material expression. In order to understand the concept of these ideas, it is necessary to gain insight into the mode of supramaterial and intuitive thinking. Ibn Sina made a connection between the ability of remembrance and the healing. Accordingly, cardiac drugs mostly improve memory and mental function. As an example, Embolic mylobaron is a very common drug that is used as a memory enhancer and cardiotonic in our India. He stated that since it is beneficial cardiac drug due to its cleansing effect, so Embolic mylobaron strongly improves memory and mental ability. We are using a lot of patients to this drug. Another thought-provoking issue in this book is the specificity of khasiyat, and particularly emphasizing on this very important aspect. It is a pharmacodynamical concept that he describes a drug when a drug action that cannot be explained by the poor qualities of traditional medicine. For example, Iskemoni resin has hot and dry temperament, but it induces expulsion of yellow bile, which itself is hot and dry from the body, and this is a contradiction. So many cardiac exhilarants act in such a way.
Thank you, Doctor.
Various papers.
We are kind of we are about the time range.
Okay. Yeah. I am summarizing I am arriving to a conclusive point. So these are the various studies that have been published in different journals. Okay, these are the studies that have been published by different journals. So I am showing it. Okay. These are the studies of our work. And now, thank you for giving me this opportunity. It was such a nice platform to give my presentation. And again, I am very much thankful to Dr. Nazir Siddiqui, Dr. Habib Mohammadi, and Mr. Wais Siddiqui, and so many other organizing members who has given me this golden opportunity to be here and deliver my talk. So again, I am delivering my vote of thanks to all of you. Thank you.
Thank you so much, Dr. Abdurrahman, for your very... Okay, yeah, I can see you, yeah. Yeah, thank you so much for your presentation. Very profound, very informative. I hope we have you in the future seminars and conference as well. Take care of yourself. I know situation in India is kind of, very serious, and you take care of yourself and your family. We pray for you guys. Thank you so much for attendance. So, dear viewers, we're coming back. As Dr. Abdul Rauf, turn off his screen. We're going to say the last word for this session. So can you turn off your sharing screen, please? Stop share. There we go. Thank you so much, Dr. Abdul Rauf. Thanks for all attendees and whoever participated in this conference. So pretty much we are done for this session. And I just tell you what is coming. It's coming at 7. Yes, at 7 we have Dr. Rahmani. It's going to be the next speaker, and then Dr. Nazir Ahmad is going to speak, and then we have Dr. Bera Durdani, and we have Engineer Mirwais Sadiq Mal. And also we have Professor Asmatullah Durrani from Afghanistan. And then we have Dr. Tanveer Alam. So then we have Ms. Shivani Sharma, PhD candidate. She's going to deliver his presentation. And then we have Ms. Jasneet Kaur, PhD candidate as well, this evening. And this is going to be our last speaker for this evening, Ms. Partap Sharma. I appreciate it for your attention, for your time, and I hope you benefited from all these amazing speeches and presentation. So thank you so much for watching. Stay with us. Please join us back again at 7 p.m. And it's going to be another session tomorrow at 7 a.m. Then we have the same thing. It starts from 7 evening on Tuesday. Thanks for participation. Have a nice day. If you're in Afghanistan or wherever, have a great evening. If you're in the United States or Canada or other places, have a nice day. See you guys on the next session. Have a nice day. Thank you so much.